Medicare for the majority of our patients, okay, it takes over 6 months to get our money, okay? We can't survive like that.
And what do the insurance companies do?
Wait, we get reimbursed quicker from the insurance companies than we do from Medicare. Wait, let me finish.
Okay, go ahead.
My problem is, we're already between Social Security and Medicare $57 trillion in debt for those two programs, okay, alone. If they cannot pay us now for Medicare, how in the hell are they going to be able to pay us under a single payer plan? They can't. We'll go down the tubes.
We pay into the plan. You weren't listening. You weren't listening. The point is you're going to pay premiums.
I want my insurance that I have now. I don't want
So you're an advocate for you're standing here as an advocate for the insurance companies, and you know if you're in healthcare that, well, how many times does a doctor have to get on the phone with some clerk to Medicare to ask if they can do a CT scan or a PET scan or whatever? You do PET scans all the time. I'm in cancer. Okay, I'm a nurse practitioner. I take care of cancer patients. We have to do PET scans all the time. Okay, PET scans, CTs, really well contrast. You know that's part of the staging, restaging, etc. Bottom line is, the doctor is having to talk to some clerk with maybe a high school education, and he's having to fight with them. They're going down a sheet of checkoffs whether or not they can do a CAT scan or not. And a chemotherapy, you know how much chemotherapy costs? $28,000 a month for some of these drugs. Okay, and how many? Mostly Medicare covers these things. Okay, the patients get taken care of, and you may have a delay in payment. But you know what? The bottom line is,
operate on nothing.
That's what the answer to this is. You're not going to cut costs if you keep the system that we have. There's been decades that the private health insurance industry has had to change things, and have they? No, they have not. They have had the opportunity, and right now they're buying off all the congressional people, and this goes to the root of our problems, which is the political system. As I just indicated, I'm giving you a first-hand account of how it works. I didn't go for it, so I'm not in Congress. Jimmy Brown-Wade is, Kathy Castor, she takes contributions from the healthcare industry. Max Baucus is quintessentially, exemplary.
They're irrelevant, okay?
It's totally irrelevant.
It's never going to change unless you have public financing for college. It's never going
Absolutely.
Term limits, public financing.
Public financing,
the only way it's going to change. You have professional politicians like Barney Frank in office for.
And don't forget all the Republicans. It's the same deal for
I'm talking across the board.
Across the board. Exactly. That's exactly.
So what you're trying to do, it's never going to change unless we enact public financing.
And who is responsible for enacting it? Who's responsible for enacting it? Congress, and they benefit from the current system. So it's likely, and any time this is going to happen. I'm for a national public referendum on public campaign finance reform, election reform. We contested my election in 2006. We found the votes weren't counted properly. We found evidence.
Let me ask you guys this. When he said, though, about the system needing to change right now from what it is, do you agree with that, or do you think the status quo is
You need tort reform?
Yes.
We do need what I call medical litigation reform, because
defensive medicine is costing this country.
Exactly. I agree with that 100%.
Okay, so that's first.
CAT scan for every head joint.
And that's competition opened up across state lines.
Yep.
For everyone. Just like this lady. We all know what needs to be done except the members of Congress.
Tax deductions for health savings accounts.
Health savings accounts are basically, number one, you have to have this discretionary income for a health savings account. How many people, especially in this economy, have discretionary income? Health savings account is basically just another tax dodge opportunity for people with money. I mean, the bottom line is, if you have a real public option, I will score a legitimate public option. What's coming out of the Congress and the Senate is not legitimate. One that offers everyone the opportunity to buy into a public plan that has no need for. Listen, McGuire, the head of United Healthcare, you want to know how much he makes an hour? Well, it's $102,000 an hour. Who is worth that? And how many people could be employed with that kind of egregious? I mean, that's not capitalism. That's not capitalism.
What about the basketball players? I mean, you can't start dictating society. If you don't want United Healthcare, you don't get United Healthcare.
But their contributions are preventing the change in the system that would make that guy have to compete with, they make these plans have to compete on an even basis because they have the marketing, all the marketing, these commercials, the campaign contributions,
Let me ask you something.
basically are now driving a public
You know what you need, your mission
away
to reform savings accounts.
Someone from New York to get
You
health
can't
care
get the best health care in the world.
And would that provide enough
Is that we have a lot of things that you don't have in other countries. We have gun deaths and other kinds of murders that occur in this country that don't occur in other countries. After you factor those out, what I have read indicates that our health care saves people's lives as well as anybody's. And also, I mean,
We lack in preventative health care. France is number
Those
one.
companies cannot.
France is number one.
Can I respond to something you said a moment ago? Your comment about how much a particular CEO makes, that sounds like the same class warfare
So-
bashing I
It
hear
is
about
class warfare.
the
To have versus to have nots, especially in health care.
Well, right. I think he brought it up because everybody's saying
that's
that
not
the U.S. that
The upper class
that
and
give them
if you have
the other companies as well. But I mean,
my point is that the same sort of class warfare rhetoric you hear about people complaining about the oil companies making money because
so
they're selling
any of the proposal, I mean, the bill.
But when you look at their comments each year,
Some of the Democrats say.
it's a 7% profit margin they have year after year. Well,
No, it's not nonsense. Why don't you go read it, get educated? If you think you're going to run for Congress again, you better get more educated. What we need
Yeah, like your
is
figures about $1 trillion some dollars, that was real educated.
I mean, you know,
7 trillion is completely off the wall.
50